love these smelly markers. Oh, is it filming? Oh, shoot. Okay. Good afternoon, and welcome to my lecture on the Affordable Care Act 2013. I am your professor, Jamison. What I want to talk about today is healthcare reform, because it's been in the news for so much over the last few months. Specifically, I want to talk about how we're going to fix healthcare by the implementation of this law. We all witnessed last month the embarrassing spectacle of the Tea Party minority in the House of Representatives decide to shut down the government and risk defaulting on the country's debt for the sake of delaying and defunding Obamacare. And while I do not agree with their tactics, I do agree with the Tea Party on one point, that the Affordable Care Act will not solve our country's healthcare problems. But unlike the Tea Party, I will give some intelligent reasons why and offer an alternative. Imagine that. So, what exactly did the Affordable Care Act do? Well, President Obama thought that there were too many people that were uninsured in the United States. Said that we needed to get health care improved in some way, shape, or form. How did he decide to do that? Well, he decided to do that by things like eliminating lifetime limits on benefits, by covering kids until they're 26 under their parents' plan, expanding Medicaid for the poor, by eliminating the requirement of insurance companies to test for pre-existing conditions so that anybody, regardless of medical condition, can get a plan, set up health insurance exchanges in the marketplace that would allow for competition amongst different insurers. And then they tried to put in a public option, but that got shut down, saying that it was too much of a government reach, even though the expansion of Medicare Part D, the prescription drug plan for the people that are on Medicare, was not. Have to figure that one out later. Anyways, the question that I have about the Affordable Care Act, the first one that I have is, how is getting everybody into an insurance plan going to improve care in the United States? I wrote a list of all of these things that I just mentioned that are being passed by the Affordable Care Act. These lifetime limits, not being turned out for pre-existing, children covered under their parents' plan. You can see what I've circled is in the word insurance in every single one. So it sounds like what the president is trying to do is not necessarily fix the quality of care, although I'm sure there's some provisions in the Affordable Care Act that are doing that. It looks to me like he's really just trying to get people under insurance plans. The big argument against the government option, the public option, which is something that the Republicans opposed, was that they didn't want a giant entity, the government, getting in between you and your doctor for care. But I would argue that right now, isn't it the insurance company that's getting in between the doctor and our care? They're the ones that are denying us services for certain things. The prices seem to be going way, way out of control, even with the implementation of the Affordable Care Act. So maybe we should stop calling it the Affordable Care Act and maybe the Affordable Insurance Act by trying to get more people into the system. But even then, I'm not sure that that is a legitimate title for it, given the fact that a lot of people's premiums have been going up as a result of this act. If I could wave a magic wand and I could say, how can we fix healthcare reform? I would say we should get rid of the middleman altogether. Insurance companies, government, and have people go directly to doctors, of which there are many, to get their services rendered. We have healthcare in the United States. You know, President's saying we don't have access to healthcare. Well, we do. There's a hospital right down the street. My doctor is in Walpole. We can just go right to our doctors and get care. That's health care. What I think he was saying was that we don't have insurance for everybody. It's 47 million uninsured in the country. So he's equating health care with health insurance. So given the fact that they're going to accept that there has to be a middleman in between us and our doctors, we have to work within the confines of that system. It's going to be too difficult to just get rid of insurance companies altogether and get rid of the government altogether for health care purposes. And believe me, I'm not trying to say that health insurance companies are the bad guy here. I think that everybody is kind of playing along with the game according to the rules that have already been established. So it's not like there's some bad apples over here that are causing this problem and that they just need to be gotten rid of. That's not the way that it is. I think that insurance companies are necessary because there are a lot of procedures that we could get paid out of pocket, but then there are some that have to be paid because it's too much for us to bear. So there has to be a pool of resources that are being used to pay for these big procedures that pop up every now and then. But health insurance is a strange market. I mean, there's all these middlemen in the way, there's all of these government systems in the way, and this is a political cartoon from the Miami Herald that shows just this. So there's us, and there's our doctors. And then there's this big middleman in between. This one is making fun of the Republicans' criticism that they didn't want a public option because they thought that it was going to be a big government plan in between you and your doctor. Well, some people would say that the insurance industry is getting between us and our doctors. And insurance premiums have gone up so high that many people can't afford them. I would argue that it's because there's really nothing holding it back. And the insurance company is being used to facilitate every transaction, including physicals, including small little blood tests and flu shots and all this preventive care. I guess that's good, but the preventive maintenance that you do on your car, for example, isn't covered by your car insurance. Your oil changes, flat tires, all that stuff. And wouldn't the prices get a little distorted if it was covering those things? And it would be an admin nightmare. All the people that would have to be hired to track that. What I think needs to be done, if we're going to accept this system where we have these middlemen in between, if we can't get rid of them altogether, is we need to have real insurance reform. The way to do that is to get the insurance companies to compete for our business. That'll make them more efficient, that'll keep prices down, and it will also be a tax savings to the government, which will allow it to pay for Social Security and Medicare, other hot button issues out there. We need to end employer-sponsored insurance. Employer-sponsored insurance is the insurance that we get through our employers as a tax-free benefit in addition to our 401ks, our dental and vision plans, life insurance plans that we might decide to get as an optional supplemental benefit. Everybody's getting mad at me right now. I can feel it. I can feel the tension. They're saying, Jamison, you can't take away my health insurance because I've got my kids on it and my wife or my husband, and it's too expensive in the private marketplace. Well, why is it too expensive in the private marketplace? You know, we've come to accept insurance from our employer as something that is absolutely necessary. How did it get that way? I mean, do other countries have their insurance covered by their employer? And why don't we just get paid more and then use that money that we have to buy our plan on the market the same way that we do with our car insurance? Wouldn't that make more sense? You notice that there's a lot of ads on TV advertising car insurance, but there's no ads for health insurance on TV? It's hard to switch, you know, hard to compete. Well, employer-sponsored insurance plans came about around the time of World War II. There were price and wage controls that prevented employers from paying a lot more money than they wanted to. Wages and the added cost and the price of goods were being allocated toward the war effort. And that was good for the wartime, but afterwards it became a big problem. So employers started offering employer-sponsored health insurance plans and other fringe benefits because they were not subject to those price and wage controls. In the 1940s, the National Labor Relations Board determined that health insurance and 401ks would be included in collective bargaining agreements. In 1954, corporations were allowed to not pay tax on health insurance plans. And then in 1978, individuals did not have to either. But over time, it's gotten out of control. Because in 1950, only 5% of your compensation from your employer went toward things like health insurance and 401k. Now it's 20%. So there's been a loss of wages in addition to a distortion in the prices of health insurance on the private market. And to give you an idea about that distortion, I can show you a graph that shows how high the prices have risen over the last 10 years. In 1999, family health insurance plan was $5,791. Dark blue shows employer contribution, orange shows individual contribution. It's risen 2011 to $15,000. You know, what's keeping it in check? And the reason why it's so important too is because it's a big chunk of the market. This shows a breakdown of how many millions of people are involved in these different plans. So there's uninsured, direct purchase, Medicare, Medicaid. Employer-sponsored plans account for 55% of the healthcare marketplace in the United States. So if you can fix this, you're going to fix a lot of stuff. Medicare and Medicaid, they're not going anywhere. There's always going to be some uninsured. But we can get more uninsured into a plan if we can figure out a way to get rid of this stuff over here. And part of the reason why we can really see the results here is the tax breaks that are given on these plans. So when you get that health insurance benefit through your employer, it's not taxed. It's the biggest tax giveaway to the middle class and wealthy, bigger than mortgage interest deduction, bigger than employer-sponsored retirement plans like 401ks. So $203 billion is the amount of revenue that is not going to the federal government or the state governments to pay for things like Medicare and Social Security. Other things that there's huge fights about funding for, right? I'm not saying we should give the government more money. I'm saying that when you give favorable tax treatment to certain things, the government is in essence paying people to do certain things that they would do anyway. So we don't need to be paid to buy health insurance plans. We don't need to be paid to live in a house. That's another issue. But I think that if we can get rid of the favorable tax treatment on employer-sponsored plans, there'll be less of an incentive for employers to give them, less of an incentive for employees to want them through their employers, and we can purchase them on the open market. There's some people have told me that I can't leave my job because they offer me insurance, and even though I don't like my job, I'm going to stay with it because I have a medical condition. And so that really, really distorts the marketplace because the insurance companies know that they don't have to compete as much for your business. So I want you to think about that. Just think about how we might be able to change the marketplace for the better and not just try to get more people in. And one thing that I forgot to show everybody was, by comparison, the cost of car insurance over that time frame. So apologize for leaving that out, but this is an important point to make. So I was showing you before that there was that it went from $6,000 to $15,000 over the course of 10 years for health insurance. Well, car insurance went from $726 in 2001 to $791 in 2010 on average across the United States for the bare bones plan. So we're not talking about collision or anything like that. So again, car insurance not purchased through the employer. Everybody gets it on their own, but there's mandates for it still. Health insurance is purchased through our employer, pre-tax, distorted marketplace. Thank you.